1970 WOCA.
Ocala. Diamonds in the sunset, now your time has come.
Not good to knock over the camera when you're recording a video here. All right, how many times have you gone to the emergency room and found out you could have gone to urgent care, or vice versa? You didn't quite know the difference. That is sort of what we're going to talk about today. I hope Ocala Health System, once again, to help us understand some of the important health issues associated with us and our health. Summer Lynch is in the studio. She's a registered nurse, and she's the Director of Emergency Services and QuickCare at West Marion Community Hospital. And Polly Spate is in the room as well. Polly is the Director of Emergency Services and is also a registered nurse. She's also at Ocala Regional Medical Center. Good morning, ladies. How are both of you?
Good morning.
Morning.
We're good.
Thank you for coming on the air with us today.
Thank you.
So I've made this mistake.
You have.
I've gone to the wrong one. Yeah, because you never know. I mean, now I've never had anything really serious, so I've always thought, well, that would be a no-brainer if I was having a heart attack, ER, right?
Correct.
So that's an easy one. But what kind of what's typical? What do you typically see that's the wrong one? They should be in one or the other.
Well, the first thing I'd like to say is that whether you go to the wrong one or not, it doesn't matter.
Oh, it doesn't matter.
That's the nice thing, because
Okay.
we will triage you and we will get you to the right place.
Okay.
So even if you go to QuickCare and you have chest pain, we'll triage you, we'll get you over to the main. So we'll always take care of you.
Okay, that's good to know.
So Ocala Health actually has two different things. We have QuickCare, which is part of the emergency room at West Marion. And then we also have two urgent care centers, which are located off-site. One is in Bellevue, and one is actually on 25th Avenue. So urgent care centers have very set times, usually open kind of during business hours, maybe a little bit later. They are typically run by a primary care physician. QuickCare is actually a part of the emergency department. Emergency trained physician sees you in QuickCare, and we're open typically even later than urgent cares. And as a mother, truly, that's the place where I'm going to take my kid when they wake up at 11 o'clock at night screaming from ear pain. That's where I'm going to take my family.
Okay. Now, in the changes that we're seeing right now in the healthcare landscape, I guess you would say, with the new healthcare laws, will you see in your profession fewer people making that mistake?
I think we're going to see people using the ER more and more. So whether it be QuickCare or the emergency department, I mean, we are their primary care. So,
And maybe that's why I'm asking, because I got the impression from all the news we've been reading about the healthcare, and I don't even pretend to understand it, but it looks like we'll know who to go to when something happens, and that might just be your doctor.
It may just be, but in the middle of the night when your doctor's not open,
that's when
we're still going to be the place where everybody's going to want to come.
Yeah. So there's plenty of locations around. Do the modern technologies help at all? Can we get an app or anything like that helps us maybe understand better?
Yes, we actually have an app called iTriage. And that app actually shows you our wait times. You can also see those wait times on billboards around town.
I've seen the billboards, yes. And I always look at that and say, oh, don't look at it, because I don't want to know that. I don't want to need to know that information.
Exactly.
Yeah, does that happen? Am I alone in that one?
Actually, you would be surprised how many people we call that want to know the wait time. So it's nice that we have the app and the billboard, so they don't have to call the hospital. They can just look it up and decide where they want to go.
So how do you get the app? I guess we'll just take it.
You go to your applications, however you download it off your phone, and look up iTriage. It's there. And then it's a free app. You look it up by hospital, and you can see Ocala Regional's wait time as well as West Marion's wait time.
Okay. Now, can I ask maybe a basic question? I think I'm the only one on the planet who doesn't know what this is. I never understood the word triage. What the heck is triage?
So,
am I the only one? I mean, just.
Well, I mean, I think in the medical profession we're used to it, but to lay person it may not be.
I honestly don't know what it means.
Right. So it's a word that actually came in war times of how to decide who was the sickest. So when you come into the ER, our triage nurse brings you in, and we ask you questions about why you're there, and we decide, based on different criteria, what's your level of care, where would you be most appropriately placed, either QuickCare, main ED, and also how quickly you need to be brought back.
Okay.
Chest pain's very important. Those people need to be brought back quickly.
I would think so.
Could be having a heart attack.
Does the word mean anything? Tree? Does it have something to do with three?
I'm not sure.
No? We don't know. Is it spelled that way? Triage?
Triage. I believe it's a Latin form word, but I can't really tell you more
Probably.
than that.
I'm a word person, and I always think, okay, where does this word come from? What does it mean? And thank you for explaining it to me.
I can give you a word for the day.
What is it?
Acetabulum. Look it up.
Is
It's a body part.
Is it AC?
No, AC, yes. It's a body part.
Acetabulum.
Acetabulum, that's your word
It's
for
a
the day.
body part. Mm-hmm. I'll think about it.
There you go.
I'll think about it. Polly, good morning.
Good morning.
How are you?
Good.
So the work that you do, is it similar to what Summer does?
Yeah, at Ocala Regional Medical Center, we don't have a QuickCare that Summer was talking about, and the QuickCare is really those things that they're your minor care. We do have a separate place, and we try to just get those people in and out of here quickly. If you have a crying baby and they have an earache, you want to get in and out.
Right.
So that's what we try to do. We try to separate those people away so that we can get them in and out. We call it our rapid triage center. So we just try to, target those people, get them in, get them out, get them
Right.
the care that they need, and get them gone.
Is it harder with little children?
Well, have you ever been awake with the child at 1 o'clock in the morning? That's
no,
what's hard. As far as the care, no, the care's not really.
I mean, as far as the triage part, what you just explained what it is. I mean, and when I say little children, I mean little children that maybe can't speak or can't articulate. How do you know who's the worst?
So, you have a crying baby that's screaming.
Fever's gotta be a big one,
And,
right?
we take their temperature, and their fever's high. Babies get high temperature. But they're crying, they've got good tears coming down. They look okay. If you bring me in a baby that's just floppy and lifeless and not really,
my God.
not really talking to you or crying or anything, I'm going to be a little more concerned about that one.
Okay.
So, if a baby that's sitting up and crying, that's a good sign. That's what we want to see.
Okay.
Crying babies.
And that
For
makes
us, it's
sense.
a good
Yeah,
sign.
yeah. I would never want to see what you just described. I didn't want to say it. So, and I know you don't work with animals, but I've often thought the same thing with veterinarians. I mean, how do you know? I mean, what's going on? Especially with little children.
Not always easy to discern.
It's not.
Do you ever have the patients themselves kind of demanding that they get put to the top of the list, and you know better? You say, well, you know what, that other guy's worse than you.
We do. We just do our best to try and
So
explain
people
to them.
skills is important.
Exactly. Communication, people skills, and explaining why we triage the way we do.
Is there maybe a checklist that we could have maybe on our refrigerator or something to maybe be familiar with? So we say, look, it's not this, it's this, and therefore we need to go here, not there.
I think we're good with you come and we'll get you where you need to go.
You just don't even need
You just come in.
So
We'd
my
be glad
whole
to see you.
premise of the interview was to try to separate where you go, and
Right.
apparently it doesn't matter.
It doesn't, because we're going to do what we need to do to get you to the proper place.
Oh, okay.
That's the most important thing. If you need to come in and be seen.
Except for the fact that sometimes, I mean, you guys are really awesome when it comes to the wait times. I mean, I've been in emergency rooms in the past, and like I say, thank goodness nothing's ever been serious, but you can see people waiting for long periods of time. So.
Well, there are things that we do. Sometimes we do have patients wait, but there are things that we do, like we'll have providers see patients. They'll bring them into triage, and they'll see them in triage. We'll bring them in and draw blood while they're still waiting in the waiting room. We'll do EKGs in the back and put them back out in the waiting room. Say they may be seen by a physician. We may fully treat them while they're sitting in the waiting room, because a patient comes in to be seen by a physician.
That's true.
why they're coming in.
Yeah.
So we do whatever we can to get them seen, because that's what they're there for.
So some people actually get treated, and do they feel like they weren't because they never left the waiting room?
I don't think so.
No,
because a bed is just a bed. It's really truly about they come to see the physician.
Yeah,
So
that's right.
let's get them in, let's get them seen, and
Are the
get 'em out.
physicians in the ER always the ER physicians, or do they rotate around the hospital?
They're always the ER physicians. We have our emergency departments all have board certified emergency physicians, and that's what they do, 24/7.
Does the ambulance ever take you to urgent care?
They would bring you to an emergency room.
Always.
They would bring you to the emergency
Okay,
room.
so when
correct.
if you were in a circumstance with the ambulance driver or whoever is in the back asks you where do you want to go, you basically have to name a hospital.
Correct.
You can't just name. I'm going to go to
QuickCare.
Summer's
You
place.
can't. Right. You can't say QuickCare. Got to name a hospital.
But you can take yourself or your
Yes,
loved
absolutely.
one.
Of
Yeah,
course.
Of course. Are we seeing in Ocala something new as far as urgent care and ER Like, for example, the billboards with the timing, or is this something across the country? Are we part of a bigger trend?
Yeah, we are part of a bigger trend. People want to get in, they want to get out. We're trying to provide a service. And we do. You know, when you're in an emergency, that's why we do triage, because if somebody comes in with chest pain, that's a heart attack, I want to get them back there before I get the chest pain that's caused by maybe a cough that they've had for a couple of days. So that's why we do the triage process. And we try to get the patient, again, like Summer said, they don't come to see a nurse, they don't come to see the hospital, they come to see the doctor. So we try to get them to the doctor or the doctor's assistant as soon as possible.
And does that include accidents? And maybe not, obviously not a serious accident, but if you have
If it's a serious accident, they'd probably go to Ocala Regional, because we actually have trauma at Ocala Regional. So serious accident could go there.
Yeah.
You would think that would be the obvious choice.
They usually do.
What about like a baseball accident? You're not in a car, you get hit with a ball, what kid does or something.
They're going to bring you to the hospital.
Same thing. Same thing. You don't want to go to urgent care. Okay. Yeah. But if you did, I guess you would.
You know, if you did go to, if you made the, you know, if you chose to go to the urgent care, then they're going to, again, do a triage process and determine whether or not you meet criteria to be there. And if you don't, if they feel like you're sicker, they're going to send you on over to the emergency department.
Do you ladies want to take phone calls?
Sure.
We will invite phone calls if you would like to ask some questions. We're speaking to Polly Spate and Summer Lynch. We're talking about the Ocala Regional Medical Center and the QuickCare programs or services here in Ocala, Marion County. And it sounds like there are a number of them. So if you have a question, this is a good time to call. The WOCA number is 622-9622. That's the WOCA Climate Control Source Hotline. So the message, the big message is, don't worry about it. Just go someplace. Get some help.
Get treated. That's the most important thing.
But the secondary message is...
We have QuickCare for your minor emergencies. So it is an emergency department, but it is for minor emergencies. It's for cuts, bruises, cough, congestion, toothache, any of those things.
I was going to ask about toothache. Really?
We can see them. We don't have a dentist on site, but we can see them. And a lot of times what we see is like an abscess of the tooth. That patient may need antibiotics. So we can go ahead and get those started until they can see a dentist. So still important that they get seen.
And so is that also... a place where you could get the prescription filled in the middle of the night, or do we have enough 24-hour pharmacies?
We have a couple
around
24-hour pharmacies in town now, thank goodness, where they can go and they can get them filled.
My mom went through a bad period toward the end of her life, and I can remember needing to go to a pharmacy, and I was so grateful that there were a couple of them that were open 24 hours.
It's a big deal.
Yeah. Does the hospital itself have a pharmacy?
We do not have a pharmacy that dispenses medications to patients to take home. We only dispense in-house.
I wonder why.
I think it has to do with licensing,
okay.
I believe. Yeah.
Okay. I've often, because I didn't think that was the case, but
we only used to have like one 24-hour pharmacy, and now Ocala has quite a few, so it's actually nice. So depending on what side of town you live on, there's a couple.
Definitely. Are you ladies both from Ocala?
I am born and raised.
Born and raised here?
Born and raised.
So the accent I'm listening to is an Ocala accent.
I don't really think I have an Ocala accent. It's usually a little bit more southern. I don't know what it is. I'm like a melting pot.
Oh, that's kind of funny. And Polly, are you from here?
I've been in Ocala for about a year.
Oh, where'd you move from?
I spent about 20 years in Fort Myers, Florida, in Southwest Florida.
Okay, and that's a bigger area, obviously, more populated. So, do you see any differences here than there? Like, could you have the 10-minute wait time down there?
You talked about across the nation those initiatives, and we're definitely working on that. I think our hospital does a really good job with wait times. We're really focused on that. Our hospital really puts a lot of services into the emergency room, which is a benefit to Summer and I as we run that, because they really give us a lot of support to help get those patients through the door and to the doctor.
We have had the occasion to have an eye doctor on our show quite often, and the one thing he'll say is that if you get, let's say, a needle in your eye, something like you're mowing the lawn and something happens to your eye, he will always say, you do not want to go to the emergency room. He said, you need to go to an eye doctor. Do you differ with that?
Well, if the eye doctor's open, I think that if you can get into the eye doctor, that's your best bet.
I guess he was trying to make a point that the ER staff is maybe not equipped to handle eye problems. I don't know.
We're equipped to handle some. We actually have slit lamps. We have a lot of the things that eye doctors use. If you're mowing the lawn at midnight and you get a stick in your eye, obviously, not really sure it'll be mowing the lawn, but it could happen.
That's why they put headlights on lawnmowers.
Right, exactly. So if that happens, your eye doctor's not going to be open. So, we see quite a bit of eye emergencies.
You do?
We do. We see quite a bit.
I'm glad I asked, actually, because not to differ with him, but I thought, well, maybe that was then and this is now.
No, I think it's getting to the right care at the right time.
Right.
So if the eye doctor is open, absolutely, he can get there, because what we're going to do is we're going to clean it out and we're going to stabilize you and we're going to make sure that you're okay until you can get to an eye doctor.
Right.
So if you can get to the eye doctor and cut us out, he can do it all.
Can I ask you about the snowbird population? And I mean this in all due respect. The people who live here part-time. That sometimes they're starting to show up about now.
We're starting to see an increase in business.
Are they needing to know more about the different types of care? Do they, because they're not here all year long, so they don't see that billboard all the time, and they probably, I'm not making a judgment, but they probably don't have apps. Most of them, they're up in age usually. They're not probably using things with apps. But if you're listening and you fit into that category, get an app. It's not such a bad thing to have these things. These are pretty cool to have. But is your mission to come on the radio, obviously, is to communicate. So do they have a resource, maybe like a brochure or something that they can keep on hand?
I think a lot of times what we see is that it's their neighbors or their friends. So, like, you see them in the ER, how did you find out about us? Like, you just moved here from Michigan, you just moved here. Well, my neighbors across the street said this was the place to come. They said, that they love this hospital and they treat you well, and so we came here because of that. Oh,
we've had it too.
Word of mouth.
Oh, we get it as a radio station. You get it all the time. People will call and say, "Oh my God, where do I go? I'm not from the area. They're tourists or they're snowbirds or whatever," and they will call the radio. I'm sure every radio station gets that same kind of phone call. So the message obviously is is delivered by way of the billboards and by way of the radio show. Obviously, the
billboards. We do mailers that we put out in the mail a couple times a year. I think the one thing that people in Ocala and surrounding areas need to know is that our two hospitals are an HCA company, and HCA does ER really well. They have it down to an art. They have the wait times down to an art, and they have figured out great patient flow so that we get patients in and out, and they're not there lengthy periods of time unless they absolutely have to be. Because the real goal is to get patients in and out so that we don't have patients sitting in the waiting room who are really sick and who could potentially have an issue. So that's the goal.
Again, if you're just tuning in, that's Summer Lynch right there, registered nurse and the Director of Emergency Services and QuickCare at West Marion Community Hospital, and Polly Spate with her, the Director of Emergency Services at Ocala Regional Medical Center. Do you ever switch roles?
We do not.
We work together, but
we do.
Yeah, but we don't switch. We don't change places.
We have different things that are available at each campus. So Ocala has trauma. I'm not really trained in trauma.
and what's the dividing line between something that's trauma and something that's not?
So the state actually has guidelines that they set up that meets what we call trauma criteria. So when the ambulance goes up to a scene and they can see the patient and they look at a lot of different things on how to determine whether or not it meets what we call trauma alert criteria, and they will call a trauma alert. If it meets that criteria, then all hands on deck. We pull our trauma surgeon comes in the room, we have a respiratory therapist, a radiologist, and we can get that trauma patient in through the ER in about 30 minutes to a half an hour and up to the care that they have. So it's really all hands on deck. We're going to take care of you and we're going to get you out to where you need to go. It's a great process.
You know what I wanted to do, if you don't mind? I'm going to look up a post from an old friend of mine on Facebook. His wife is dying of cancer, and I just want to read this to you and get your reaction. I'm not, there may be a political aspect to this, but this is what he wrote. His wife's name is Mendy, and this is what he typed onto Facebook, and this was just on September 29th. Since then, he's put another post that said that she's now in hospice care, so she's obviously been diagnosed as terminal. But this is what he wrote. He wrote, so they examined Mendy. Remember, on September 29th, he's optimistic that maybe she'll be able to defeat the cancer. So they examined Mendy. Her pain level is a 7. They almost have to carry her out. By the way, this is up in Atlanta. This is not here. just so people know. They almost have to carry her to the bathroom, can't stand on her own, no energy to even sit up, but her blood comes back okay and no urinary infection, and they tell us there's no need for her to stay, need to go home. Then they cited new rules in Obamacare and all the pending cutbacks, so I about lost it. This is what he writes. We are in room 101. Our oncologists are on the way. Us 1, emergency room 0. Obviously, he had a bad experience with that emergency room in Atlanta. But in all fairness to the staff up there, knowing now what we know just 3 or 4 days later, is it possible that they really did the right thing? There was nothing else they could do.
Well, I mean, I think it's a very hard line. You know, there are criteria that have to be met for patients to be admitted by Medicare standards and all of that. But, I mean, we see patients like that. And so, you know, it's up to us as nurses and as the physicians to advocate for that patient, to say, hey, like, this patient can't go home. Like, obviously, there's something wrong, and we've got to figure out what it is.
You agree with him that somebody up there made the wrong decision to tell him to go home?
I don't know that they made the wrong decision. I mean, it's a hard decision.
Right.
You know, and you don't know what the patient looked like before they came in. We don't know how long she had been like that, and there's a lot of deciding factors. Right. You know, a lot of times as a nurse, it's a gut feeling, don't you think? It's a gut feeling. If
Really?
Something's wrong. Like, we got to dig further. Like, something's up.
Right. And sometimes it's, you know, as a hospital, sometimes we're looking at a situation like that and we're asking ourselves and the patient, we don't, like Summer said, we don't know what the history was. Right. Is the hospital the best place for that patient? And we have to ask that question, because sometimes the hospital is not the best place for that patient. Yeah. So, and we are under a lot of guidelines and regulations, and sometimes it is. And it sounds like in this case, if he got his wife to hospice, it may have been the stepping stone to get to the right place. Yeah. And sometimes we have to look at that. It's harder and harder to do that because of the Medicare and Medicaid restrictions. You know, they are giving us clear-cut guidelines. This is to be admitted, this is to not. There are still a few ways around that, but it's getting harder.
Thank you for helping us understand this, and I hope that wasn't too much of a curveball bringing up his post. It was one of those things I had been wanting to ask somebody about it, and so
it's hard.
Yeah,
it's really, really hard.
By the way, I love the fact that you were able to say that it sometimes has to be a gut feeling, that you're so into your job and doing it so often that you kind of can, I don't know, zone in on somebody. Gosh, when you get home, you must be exhausted. Because when you tap in mentally and you're working physically, I know what that's like.
Right.
Right.
I think it's a trust relationship between the nurses and the physicians. You know, I don't necessarily always work in the patient population because I'm the director. So, you know, I'm back behind the scenes. But, you know, the physicians trust the nurses if they come to them and say, you know, I know we're not seeing anything, but I'm telling you something is up. When they have that trust relationship, the physicians will dig further.
Oh, that's great.
So that intuition is something great that we have as nurses, and you know, we really push the staff to build on that.
Right. Thank you both for coming in. Let me make sure we give out phone numbers, websites, etc. Polly Spate and Summer Lynch, do you want to give a phone number, a website, anything?
Well, we have the iTriage website, and then the Ocala Health System has their own website. I think it's ocalahealthsystem.com. And then, you know, there's just two separate places you can call. It's either Ocala Regional's ER, which is 401-1137.
Okay.
Or West Marion's ER, which is 291-6500.
All right, 401-1137. And what was the other one?
291-6500.
6500.
You know, and one other service that I just want to talk about for a second, if you don't mind, that we provide is we do have a service called Consult-A-Nurse. So sometimes
really?
We do. And sometimes patients will call in, and they don't necessarily need to come into the ER, but they have questions. So patients can call into that number, and not only can they give them some advice, because if you call the ER, we're going to say, I'm sorry, we can't give advice over the phone, but they can call Consult-A-Nurse, and those consultants are trained to do that. And then also, they will give them a referral to a primary care physician in town if they're new to town and they don't
That's
have
a phone
physician.
service?
It is a phone service.
Wow.
Do you have the number?
Yeah, what is that number?
It's 800.
Hold on, because I'm getting... here's my intuition doing this job. This phone call is going to come for the rest of time.
Good. No, it's a great
I'm going to be
service.
getting this call all the time. So it's 1-800...
533 1188.
1188, and it's called Consultant Nurse?
Consultant nurse, and they can help you answer general questions and also then refer you to physicians in the area that either, will be able to meet your needs or...
That is, you know what, you've been here a long time, so you might remember this. You look pretty young, so maybe not. The Star Banner used to have this gigantic index of phone numbers you could call. Does anybody remember that? I can't remember what they called it. Do you
I don't remember what they called it either, but you're right. I was little.
You
but
have
I
to
remember
put
it.
star 53, and then you get a nurse star 51, and you get a veterinarian. Remember that? Consultant nurse 1-800-530-1188. That number is going to be typed up, printed up, put on my desk because I know this is my intuition for this. Right? We're going to get calls forever.
I'm sure.
Thank you for coming in. Nice to meet you both, Summer, Lynch, Polly, Spate. Thank you.
Thank you.
If you want to share this with anybody, whether you're listening or in the studio here, it is taped as a video, and it is going to be on Facebook by this afternoon, okay? And YouTube, and anywhere else. You guys can use it as well for whatever you want. Thank you both.
Thank you so
Thank you all
much.
three. I'm sorry, all three of you. We'll take a little break, and we will be right back.
Lawsuit, Georgia is using more than